Doctor, if steroid is an answer to decreasing the swelling and the pain in my arthritic knee, can I just not take it lifelong and prevent myself from undergoing any form of knee replacement? This is a very common question that's asked to me. The answer to this is no. When your knees are degenerated to the point that it requires a total knee replacement at some stage or the other, a steroid injection only buys you a little bit of time so that you can have a pain free way of life until that particular surgery in the form of a knee replacement. The swelling and the pain are definitely reduced with a steroid, but multiple injections of the same also have side effects in the form of infection or in the form of the decreasing body response to the same injection when administered over a long period of time. So, yes, steroid is an answer in the short term, but definitely not in the long term.